My name is Kiran Sajja. I'm an oculofacial plastic surgeon here at Milan Eye Center. And in this episode of Ask an Ophthalmologist, we'll be discussing specifics about eyelid surgery. Now, one main question is, what's an oculofacial plastic surgeon? Well, it's an ophthalmologist that has specific and specialized training in surgery around the eyes and the face. I also specialize in facial injectables and laser aesthetics. In today's episode, we're going to be speaking specifically about a type of eyelid surgery called upper blepharoplasty. Now, upper blepharoplasty essentially deals with the excess or redundant skin of our upper eyelids. This skin can rest on or over our eyelashes, impeding our peripheral vision and giving us an appearance where we look tired and disinterested. The procedure involves removing some of that excess tissue to give a more rejuvenated appearance to the upper eyelids and helps improve our peripheral vision and the brightness of our vision. So when discussing eyelid surgery, specifically upper blepharoplasty, patients oftentimes have several questions. First, what are the causes that result in having this much tissue? Well, one is simply changes that occur over time. As time goes on, our skin becomes a little bit stretched and loses some of its natural resiliency. And as it does so, it starts to rest on and over our eyelashes. A second possibility is that our brows start to descend. Some of the natural support for our brows basically lies in the fat pads underneath. So when that fat starts to thin, our brows descend and take the skin along with it. Patients will often remark that, could this be hereditary? And the answer is yes. Facial characteristics run in families, so if your mother or father has similar characteristics, chances are over time you'll develop the same. Second question is, how is this procedure performed? Oftentimes this procedure can be performed in a number of different settings. In my practice, I perform this procedure under local anesthetic with some moderate sedation. What this means is that I first allow for a little bit of medicine to the area of the surgery so that it's numb, so you don't feel any pain or discomfort. The sedation often offers to relax the patient to really alleviate a lot of the anxiety that can be associated with any type of surgery around the eyes or face. Through a small incision along the upper eyelid, the excess skin, muscle, and tissue is removed to give a rejuvenated and a tighter appearance to the upper eyelids. Third question we often see is, what's the recovery like for this procedure? Well, a lot of the recovery depends on the way that the surgery is performed, and you're sticking with the postoperative course. So after surgery, I have patients use cold compresses for several days, stick to a medication regimen that includes antibiotic pills, topical antibiotics, and a homeopathic remedy that helps with swelling and bruising. This oftentimes results in resolution of bruising in about 7 to 10 days and swelling in about a week or two of following. Third question is oftentimes having to do with the cost of the procedure. Could this procedure be covered by my insurance? And oftentimes the answer is yes. When dealing with these concerns, we really have to see if there is a specific complaint. Do patients have difficulty seeing? Is their peripheral vision being deteriorated by this excess skin? Are there activities of daily living affected? This can mean things like driving or reading. Also during the examination, we perform objective testing to see how much the skin may be affecting their vision. The combination of all these factors is used to send a predetermination to your insurance if needed, and this determines if the procedure would be covered. Oftentimes, if there is no coverage, then it would be considered a cosmetic procedure. I hope this gives a little bit more insight into upper blepharoplasty and eyelid surgery in general. If you do have any further questions, always feel free to check out our website at milaneyecenter.com, or always feel free to give us a call to set up a consultation at 678-381-2020. Thank you for tuning in for this episode of Ask an Ophthalmologist.